Shalom and welcome again to Seekers of Meaning, the podcast TV arm of Jewish Sacred Aging. I'm your host, Rabbi Richard Address. Thank you very, very much for joining us today. We appreciate your time and your interest in what I hope will be a very, very interesting and exciting conversation about a subject that comes up just about all the time in workshops around Judaism, ethics, medicine, etc., etc. Before we begin, just a reminder, if you'd like to contact us with ideas or suggestions, just email me at rabbiaddress@jewishsacredaging.com. Go to the website, jewishsacredaging.com. Join us on the Facebook page and all that other social media stuff, which all of you are quite familiar with. And if not, grab a grandchild and they'll just know it off the top of their head. Please welcome to today's edition of Seekers of Meaning, Lara Moretti, the Director of Family Support Services for the Gift of Life Donor Service Program. This particular office based across the river from where we are in my hometown, Philadelphia, Pennsylvania. Lara, welcome, welcome, welcome. Thank you very much for joining us. How you doing?
I'm good today. Thank you for having me.
Oh, listen, our pleasure. Many, many years ago, about 20 some years ago, during the tenure of the Department of Jewish Family Concerns, when I worked for the Union for Reform Judaism, we produced this little congregational 100-page guide on organ and tissue donation. And we were amazed that most of the people that we were talking to, many of the people, had no idea that this was possible within the Jewish community for a whole variety of reasons. Now, let's fast forward a quarter of a century. How has that changed? How has the awareness within general population, but specifically within the Jewish community, how has that changed regarding organ donation?
You know, I think a lot is the same with donation, but so much has changed. I do think awareness is much greater. I've been working at Gift of Life now for 20 years. And so I've seen the changes in all of our communities, just understanding what donation is, what does it mean, how does someone become a donor, and really how none of our major religions are against donation. In fact, they think it's a good thing to do.
Correct.
So I think overall, just as the general public becomes more aware of what donation is and transplantation, it's maybe not as experimental. It's not as strange. More people are hearing about individuals who've had a transplant. So it's just become a little bit more normal in kind of everyday communities. I think that kind of trickles down to all communities of faith, including the Jewish faith.
Right. When we go out and talk about this or ask about this, and this is important for everybody to understand, all the denominations of Judaism understand organ donation as a modern mitzvah.
Right.
The Talmudic reference of pikuach nefesh, of saving a life,
yes,
is the foundational principle of this. So it's
right.
really important, whether you are to the right or to the left or in the middle, it's a modern mitzvah.
Yes.
The next question that comes up all the time, especially as we go out for Jewish Sacred Aging, and we're dealing with the over 50 set, is how old is too old?
Everyone has the potential to be a donor. Everyone, regardless of age, health, or medical history. Everyone is evaluated case by case. The oldest donor in the United States was 98 years old.
Wow.
The gentleman donated his liver. So we don't want anyone to think I'm too old and then therefore I shouldn't be a donor. With every medical referral that our organization or organizations around the country like ours get, we evaluate every case individually.
So it's a matter of healthy organ as opposed to healthy individual?
Yeah, exactly. And, someone could have multiple medical conditions, but that doesn't mean it affects all of their organs. So someone might have kidney disease, but may still be able to donate their heart or their corneas, right? So it's a very individual evaluation.
Could you, off the top of your head, you may not, because I didn't ask you to prepare this, and that the success rate, you mentioned heart, and so those of us of a certain age remember Christian Bernard in this. We remember that, watching the news that night on Huntley Brinkley and what they're doing in South. This was amazing. People didn't believe it. Fast forward now, the success rate for these types of heart transplants, is it over the 90s? Is it over 90%?
You know what? I don't have the exact numbers, but the success rates are remarkable, right? It's really not considered experimental. These are life-saving treatments. Certainly there are medications and follow-up that's required after a transplant, but the 1 year, 3 year, 5 year survival rates are very high. We have volunteers who are working with us who, there's a gentleman, he had his heart transplant over 20 years ago. So and you look at him and you would have no idea, right? These are individuals who are able to resume amazing quality of life. It's not just that they're living, they're thriving.
So I would assume then at the same amount of, let's say, the last 50 years, the incidence of rejection, the rejection drugs, if that's the right word, have improved to the extent that that's added to the success. Is that correct?
Absolutely. Yeah, the anti-rejection medication has dramatically changed over the years so that they can use lower doses of the anti-rejection medication to be able to fend it off, which of course would have less side effects. So the choices of anti-rejection medications has really dramatically changed the success of transplants.
So I'd like to ask you if you could decode the process.
Sure. Yeah.
Is there a national clearinghouse for organ donation, or is it handled on a region by region by region basis?
So, yes and yes.
It's a very good rabbinic answer, by the way.
Thanks. So the United States is divided into different communities that are serviced by organizations like Gift of Life. And so there are regions of the country that are covered by different organ procurement organizations, or OPOs. Gift of Life is an OPO. These are federally designated regions. And so what that means is, but we're not federal organizations. We're independent nonprofit organizations. And so what that means is if anyone dies in one of the hospitals in our region, it is Gift of Life that will work with that family. So every hospital kind of has their associated organ procurement organization. There is a national law that when someone passes away, the hospitals are required to call their local OPO to let them know of the death. And that is so that organization can do an evaluation to see if this is someone who might be medically suitable to be a donor. We don't want the hospitals determining this because things change all the time. This is not their area of expertise. It's the organ procurement organization's area of expertise. So we'll do an initial kind of medical evaluation screening over the phone with the healthcare team. And should it be, on the surface looking like this person might have some medical suitability to be a donor, we would then proceed with potentially talking to the family. The timing of talking to the family is also very, very important.
Dicey.
Well, yeah, and it's really challenging. This is such a time-sensitive process. We don't have the luxury of waiting weeks and weeks to talk to somebody about donation. Sometimes it's within, minutes or hours after finding out that their loved one has a grave prognosis or is not going to survive their injuries that we have to talk to the family about donation. And so someone from the OPO will approach that family, sometimes in the hospital, sometimes over the phone. Again, it depends on timing and circumstances. And we'll discuss with them the opportunity for donation, what that means, what their loved one might be able to donate, and kind of the steps that would need to be taken for us to fully evaluate the medical state of the organs and could we find potential recipients for those gifts.
So if I have not filled out an organ donor card or haven't documented this on my driver's license, etc. You get a call, let's just say for the sake of argument, I'll pick something locally from Virtua in Voorhees, New Jersey.
Right.
You then try to reach out to the family that in the moment of crisis, and that family says, we've never discussed this. Mom was never.
Yeah.
What happens then if they've never designated? Do you just give up, or you just try to talk to them?
Yeah, most people don't talk about this.
No, I know.
Either they don't have it on their license, or if they do, they haven't talked about it with their family. Because, as a general rule, I think we don't like talking about death and dying. So, or we think it's not going to happen to me. So why should I talk about this?
Correct.
So it is not unusual for us to have conversations with families who say, we've never talked about this. I don't know what my loved one would want. And so we have trained staff who really engage families in a discussion, explaining again what this means, what the gift could mean to others, and also getting a sense of who this person was. Did they live their life in a way that donation would make sense, right? If they could answer the question now, what do you think they would say? And so our coordinators spend a good amount of time talking to families about this. And, in those cases, if someone had not made that decision prior to their death, the family makes the decision then to proceed with donation.
So how much, or if at all, does Gift of Life, and we'll just keep with your OPO as opposed to the ones scattered across the country, work with clergy of all denominations and say, when you counsel a family, when you say do that pre-funeral intake, which by then the person either has died or right on the way, when you teach a class in your denomination's approach to end of life, here's how to insert or raise the issue of organ donation. Do you do that? Is that part of the outreach?
So certainly we partner with hospital clergy because we know that they're vital in supporting families during crisis. It's really our, the ideal is that donation should be brought up primarily from the organ donation program. Because we don't ever want a family to feel like the hospital has given up or has decided, we haven't done everything we possibly have. So the timing of bringing up donation is such a critical, important factor to the discussion. So while, we do want to educate our hospital partners so that if a family asks or brings it up, they feel comfortable talking about it. But we really have found that if it's brought up too soon, and often when it is brought up by the healthcare team or the clergy, it's because they know that it can be a good thing, and they're bringing it up because they want to offer something of comfort to the family. But if the family isn't at that moment where they're really able to think about the reality of what's happened, it can be really shocking, and actually they can really, I think, pull away from that conversation. So
go ahead.
I was going to say, so we really just encourage them to listen and be supportive. And if a family brings it up, that's an important time to reach out to the members of Gift of Life and say, hey, we think it's important for you to talk to the family. They're asking questions.
So in other words, there's a board of rabbis in Philadelphia. There's a board of clergy here in South Jersey and in all the major cities. There's no sense of outreach to these boards of clergy, regardless of the denomination, to say, this is how you access us. When you talk to a family, keep this in mind. This is something, or is it just too overwhelming?
We do have, and actually November is a month where we really highlight our partnerships with houses of worship, houses of faith.
No, that's all right.
We actually have something, we call it National Donor Sabbath.
Right,
or Donor Gift of Life Donor Sabbath, where we encourage clergy to talk about it with their congregations. Because we also know that if people have thought about it before they're in that moment of crisis, before they're in that moment where there's an emergency and they've just received this terrible news, if you've had a conversation, if you've thought about it beforehand, you're just in a different state of mind to really kind of think about, is donation the right thing to do for my family? So we do spend a lot of time throughout the year, but we really highlight it in November outreach to our clergy in our community.
What's you mentioned the catchment areas for the different OPOs. So you're in Philly. What's the catchment area for Gift of Life here?
Yeah, sure. So we cover Eastern Pennsylvania, Southern New Jersey, and all of Delaware.
Oh, okay.
Yeah.
Okay. We're speaking with Lara Moretti, the Director of Family Support Services for the Gift of Life Donor Services based here. One of the OPOs this one based in Philadelphia. We'll be right back with Lara in a moment.
For 20 years, the Lubetkin Media Companies have been producing award-winning audio and video programs. We produce audio podcasts, documentaries, seminar panels, conference speaker videos, tribute videos, and family legacy videos. And of course, the Seekers of Meaning TV show and podcast for Rabbi Richard Address and JewishSacredAging.com. I'm Steve Lubetkin, and I'd love to invite you to explore the ways that we can tell your story in sound and images. Please visit our website at beingthemedia.com, where you'll see examples of our work for other clients. And if you'd like more information, please email steve@beingthemedia.com. Thanks a lot, and we'll see you out there on the net. Take good care.
Welcome back. Welcome back again with Lara Moretti from the Gift of Life Donor Services Program, one of the organ procurement organizations based around the United States of America. She's the Director of Family Support Services. Real fast, Lara, somebody wants to check something out, get some more information. The website is?
It's www.donors1.org. So DONORS1.org.
And I would assume from what you've been saying before, there's a speakers bureau. So if an organization wants somebody from Gift of Life to come out and do a presentation, they access that also through Donors One.
Yes, absolutely. And we have a wonderful network of ambassadors. These are individuals who've either had a transplant or maybe are a member of a donor family who can really talk about their personal experience. And certainly those personal stories are so powerful. So yes, we would be happy to have someone come out to someone's community to talk about donation.
Talk to me about the challenge, and I would assume it's a real challenge, of the various and sundry types of communities, ethnic, language, religious communities that just exist in your catchment area alone.
Right.
Between those, your area is over the number of just cultures, languages, customs. Not everybody does death the same way or even approaches this. How do you begin to get this message across in all these varieties of different cultures and communities?
Yeah, so we get the message out in lots of different ways, through print or traditional media, through social media. We have outreach in schools because we know, especially as young people are getting their driver's license, we want them to have this information when they are faced with the question at the DMV, do you want to put it on your license? We have partners in our healthcare community. So we work very closely with our hospital partners who already are doing wonderful outreach in their communities. We partner with them to get the message out. So many different avenues, recognizing that, people get their information in lots of different ways.
I'm sure you've heard these stories, the waiting list. I'm on the waiting list for a kidney transplant, et cetera. Talk to me about the mythology that, if I know somebody, you're driving down the expressway and you see a big billboard.
Yes.
I need how do you deal with that?
Sure. So I think this kind of goes back to your question where you asked me, is it local or national? And I said yes or yes. So yes, there is a national waiting list, right? UNOS is the list that keeps track of all of the individuals who are waiting on the list. There's over 100,000 people in the United States right now waiting for an organ transplant. 17 people are going to die each day while they're waiting. So we don't have enough organs for everybody. So that's why it's really so critical that everyone considers this as an option for them. We have about 5,000 men, women, and children in our region alone who are waiting. So when we have a family or when we have a potential donor, we are going to access that national list. And it is based off a lot of factors, how someone's organs are going to get matched with those potential recipients. Blood type, the size, right? You're not going to be able to, a 6'4" man's lungs aren't going to fit in a 4'11" woman's body, right? So there's things that they consider, all kinds of matching markers in blood.
Wow.
So there's a lot of evaluation that goes into it. But anyone's organ, a man's organs can go into a female, white into black, Asian, Hispanic. That doesn't matter. It's really all these other factors that they look at to make sure it's a good match beyond just blood type. Now, families, if they know somebody, maybe it's someone from their congregation who is waiting for a kidney, they can say to the organ procurement organization, we know somebody. And if they give them that name, we will work with ultimately it's that transplant surgeon's decision if that organ would be a good match for their patient. That's called directed donation. It doesn't happen a lot because matching is hard, right? So not everyone's going to match. Even if you know somebody, you're not going to be a match. But that does come up sometimes, and sometimes it happens, which is amazing and beautiful. But more often it's to someone who is completely anonymous, who is on the top of the list because they are the sickest, they've been waiting the longest, they are the best match.
Is it in the matching process, is it predominantly blood type?
So blood type is one of the factors. And then there's all these other factors within the blood. It's not just as easy as saying, well, I have A positive and the donor is A positive, so it will be a match. There's lots of different characteristics within the blood that they look at.
And another myth about age, the 13-year-old is going to be more likely to get the transplant than the 75-year-old. True or false?
It's false. It really depends on how long they've been on the list, how sick they are, and again, the matching, all those criteria that would make them a good match.
Another basic pocketbook question. I'm sure you deal with this every single day. Who pays? Is this insurance?
That's a good question. So there are no costs to the family of the donor, none whatsoever, because this is an altruistic gift. The recipients, their insurance kind of covers the cost of their transplant. It also includes costs related to procuring and recovering that organ. So there are no costs to the family.
Hospital stay, follow up. Is that
for the donor?
For the recipient.
For the recipient, so that's through their insurance.
So basically, if you have good insurance, which is a whole other conversation right now in this country, but a serious one, and I would imagine that you walk this walk in all of the OPOs in their office of somebody who's qualified, but doesn't have the financial backing insurance-wise to really cover that.
Yeah. So as the OPO, we are not involved with evaluating or listing patients for transplant. That is totally separate from the donor programs. That is through the individual hospitals who have their own transplant programs. They have a team of, doctors and nurses and social workers who are going to evaluate the patients and including, do they have the ability to pay for the care? A lot of people have Medicare because they might have an end stage organ disease, and that makes them eligible for Medicare. So when we are working on matching the donor organs to the recipients, we are completely not involved with deciding who those people are. That list, that UNOS list, is determined based on the transplant hospitals submitting their patients for that list. So the donor programs are not involved with deciding who gets it or who gets on the list. That's completely separate from us.
This is a really important piece of information, because I would imagine there are many people who say, well, gift of life, they're going to take care of everything for me. But what I'm hearing you say is you're the conduit, but the individual hospital, ABC hospital, will be the final arbiter of who gets and when. Am I correct?
So almost.
Is that a yes and yes?
So gift of life is the intermediary between the donors and the recipients. We work with the donor families. We get the list of recipients from UNOS, that national list. The way that someone gets on that list is through their transplant hospital, which is totally different than maybe the donor hospital, right? Someone might be a donor in Voorhees, but the patient who's getting transplanted might be at Jefferson in Philadelphia, right? So totally separate organizations. So there's nothing, we are not at all involved in evaluating who is eligible for the transplant. That's done, people are on the list for weeks and months and years, long before a donor is identified. So totally separate processes.
All right, I'm glad we cleared that up, because it's easy to become, gift of life, they're going to take care of everything. But like you said, you're the intermediary. Okay. Another issue I'm sure you've come up, because most colleagues, we will deal with families. When somebody dealing with a diagnosis of cessation of brain activity, press brain death, whatever the correct medical terminology is, walk me through the qualifications. When does that person become eligible to be a donor?
Sure.
To have their organs harvested?
So the healthcare team, so the hospital, separate from the organ donor program, would be involved in making that determination. The OPO is not involved with determining if someone is brain dead or not. We would come in, and kind of after someone is brain dead, we would be able to pursue the surgical recovery of the organs. So it's the healthcare team that has been working with the family from the moment that patient was admitted, whether it was through the ER or, in an ICU. That healthcare team that's been taking care of that patient and working with that family, they would do the tests, and there are a variety of different tests that determine brain death. Once those tests have been completed, according to that hospital's policy, the hospital would pronounce that person dead based on brain death criteria. And then we would be able to pursue the recovery of the organs. So gift of life is not, and neither of the OPOs are involved with actually determining if someone is brain dead or not. It's important to have that be separate. Obviously, they're two different paths, and we don't want there to be any confusion about our involvement. That is the healthcare team. That is their determination based on the care that they have been providing for this patient and the family for all those days.
No, I appreciate it, because the way you've outlined the steps, I think there's a lot of public misconception that there's one stop, but it's important for people to understand that there are steps. There are steps along the way, of which gift of life is one of them, and a very important one. But there are steps from basically decision to recovery.
Yeah. And hospitals work so hard to save the life of all their patients. And it's really only when everything has been determined they've tried everything and they're not going to survive and they've been pronounced brain dead, that donation can be brought up as an option. And it's really when they've tried everything, and it's hard for the healthcare team to lose a patient, And even though they know that donation is a wonderful thing and can save lives, they're also they've lost a patient also as well.
Once again, the website for information, contact, speakers, etc. is
donors1.org.
What's the most challenging part of your job?
My job?
Yeah.
So my job, I work pretty exclusively supporting those families afterwards. So I oversee a team of licensed mental health professionals. We all specialize in grief and bereavement. So we are supporting families as they grieve, and that is different for everybody. Everyone needs different levels of support. Everyone's grief is different. So what is the hardest thing? I think that's a really good question. I think it's trying to make sure that we are providing the kind of grief support that each family needs, recognizing that it's different for everybody. And so what might have worked with the last family I spoke to might be different than this family. And so really just making sure I'm really actively listening to what they are saying so that I can provide them with the best and most unique support that will work for them.
And where do you go for your support? Because working with that community every day can be a challenge.
Yeah. I have a great team. I think we really support each other. And, sometimes I need to just binge watch some shows on Netflix to kind of just not think about it. So, but, family, friends. I like taking my dog for a walk. That always feels good. So
it does.
Self-care is important, though. Absolutely.
Self-care is very important.
Yeah.
Lara Moretti, the Director of Family Support Services, A Gift of Life, Donor Services, one of the many OPOs scattered around the United States of America. I thank you very much, Lara. The work that you do is a true calling. And I hope you understand that you probably have saved and helped so many, 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 many people through a very, very difficult crisis, no matter what. I mean, it's a challenge. So thank you. And
I feel really honored that we get to work with families who, in their worst moment, think about helping a stranger. And that's really remarkable. The kind of grace that families show is inspiring. It's humbling. And it's really an honor to walk alongside them for however long that may be. It's truly an honor. I think everyone who interacts with donor families feels that way.
Well, there is something that a lot of us talk about, this theology of accompaniment.
Yeah.
And as you accompany these families through this challenge, it's a mitzvah. So thank you.
Thank you so much.
Stay safe, continued success, and be well.
Thank you. You too.
To all of you, thank you very, very much for joining us on today's edition of Seekers of Meaning, the podcast TV arm of Jewish Sacred Aging. Again, I'm your host, Rabbi Richard Address. Again, if you'd like to contact us for some ideas or responses or suggestions, rabbiaddress@jewishsacredaging.com. We really appreciate it. If you'd like to help support our work, if you go to the website, jewishsacredaging.com, you'll find a very conveniently located donate button. If you just click on that button and follow the real simple prompts, thank you very much in advance. We appreciate your support. Seekers of Meaning is produced at the Broadcast Center of Lubetkin Media in Cherry Hill, New Jersey. And a big shout out to our producer, Steve Lubetkin. Again, I'm your host, Rabbi Richard Address. On behalf of all of us at Seekers of Meaning and Jewish Sacred Aging, please take care of yourself, and until we see each other again, be safe, be kind to one another. Shalom.